opportunity to remember and pray for all those who lost their life to this COVID-19 pandemic. Selfless doctors, nurses, scientists, healthcare workers who could not make it, please stand up for a minute of silence as a mark of respect to all whom we lost to this pandemic.
As the title indicates, we have gathered here to discuss the contagious piece of virus that doesn't need an introduction, a virus that has drastically affected all spheres of our life. This conference shall boost the communications of the ideas to identify the knowledge gaps related to coronaviruses. This is the small step to creating opportunities and building an evidence-based roadmap to One Health. The expected outcome and recommendations will ensure longevity of coronavirus research and will help to continue the coronavirus research after the end of COVID-19 pandemics to combat future emerging coronaviruses. With this, I take your leave. Thank you.
Moving forward, I would like to felicitate our guests. I request Honorable Vice Chancellor Scott K, Professor Nazir Organizer, to present a bouquet, shawl and memento to our esteemed Chief Guest, Dr. Jitendra Singh. I request the Chief Guest to kindly felicitate Dr. Pragya Yadav on behalf of Bharat Biotech.
Coronaviruses have been known to science since antiquity. Talking about human coronaviruses, we have known it to cause acute respiratory infections, and then came the outbreaks of coronaviruses, be it the SARS-CoV-2 or then the Middle East respiratory syndrome. And 2 years have actually consumed the whole of the world. That is because of the SARS-CoV-2. It taught us that you have to go by evidence-based medicine.
Our respected Union Secretary to DBT Government of India, Dr. Rajesh S. Gokhale, couldn't make it to this place today, but he has sent a recorded speech for today's inaugural session. Can we hear that speech, please?
So let me start with what we have learned about from COVID-19 pandemic actually. And these infectious disease outbreaks are going to be part of our life as we go along. But as I would realize that very often infectious diseases have been primarily associated, the disease severity has been associated with the pathogen burden. What is now COVID-19 pandemic over the last 2 years have taught us that host responses to the infection is really critical modulator of the final outcome.
Post-pandemic, we are at crossroads to discuss and debate about the real and the effective strategy for that One Health program, which seeks to protect the human race vis-a-vis the health of the animals, the health of the environment we live in, and the food we produce and eat. One very important lesson what we have learned is the crosstalk amongst the stakeholders. Therefore, we thought that it was required that we need to come all of us on one platform and debate on this very, very challenging issue which we are facing. And hope this conference proves a milestone for our joint efforts to secure our people from any future biotic and or abiotic challenges. Thank you all.
We have to have an integrated approach. And that's what COVID taught us. To one of the important inferences that in the medical management also, a holistic approach is no longer an option, but it's in fact a necessity. And we have to have an integrated, but integration in the true sense. On a larger scale, in fact, as far as the science is concerned, we need to have inter-science integration. That means all the science departments and ministries in the government sector have to sit together. We have actually started that exercise. Every month I'm convening a joint meeting of 6 departments: atomic energy, space, biotechnology, Department of Science and Technology, Earth Sciences, the meteorological department, and the CSIR, the 7. By doing so, we could be more cost effective, better outcomes and less of overlap. We would have a theme and then let the various institutes and departments integrate themselves in the best possible manner. I think equally important, not only for the students but also for their teachers and us, is to prepare ourselves for that role. The earlier we do, the more meaningful would be our contribution. Thank you very much, and thanks once again for inviting me.
I have witnessed many things related to farming. That was the time of harvesting of the crop. And then our responsibility was to make the farmers aware how to deal with this corona kind of situation.
This is a very important seminar I am attending, and I feel that this is the time now to assess what has happened and where we have done good work and where we needed to do more.
We went through a very evolutionary response to COVID. But thankfully, I think our response was collaborative. We now have a fair idea of what we are presently grappling against. The mutationary evolution of the virus is of a nature where we are not really sure what the future of the virus or the future of further novel coronaviruses will be.
It's a time to remember all COVID warriors that include scientists, doctors, paramedical, frontier workers, armed forces, police forces, and above all the common Indians for their resolve and contribution in the fight against coronavirus, for which we have already made a silent stand.
I now request the Chief Guest to kindly read the conclusion of this conference.
AI का भी इस्तेमाल बढ़ना चाहिए। AI का जितना है अवेलेबल एवेन्यू उतना हम करना चाहिए।
You can play the lecture, please.
We've split focus of our network into 5 main areas. These are One Health and Zoonoses, surveillance, detection and characterization, countermeasures and interventions, so pharmaceutical and non-pharmaceutical ones, which leads us into behaviour and social policy. And then finally, this WHO idea of disease X. So what is going to be the next threat, both to human health and to animal health from coronavirus? And so we provide conference travel grants, we support network activities, laboratory exchanges, particularly for early career researchers. The purpose of this network is to promote the exchange of people and ideas.
We have expanded this surveillance not only with the Pune itself, but we have expanded this surveillance, the SARS-CoV and influenza surveillance in pan-India mode, and now 22 VRDL laboratories are doing the SARS-CoV and influenza surveillance using NIV kit again, and the overall we have a systematic surveillance now in place for influenza and SARS-CoV. We are addressing community sampling also as well as hospital cases.
This is the summary of the metadata. So if you look at the median age of the peoples in the 3 groups, so in the demised patient, the age was comparatively higher as compared to the recovered and asymptomatic patient. And if you look at the CT value, or that is the viral load, CT value was less in the demised patient as compared to the recovered and the asymptomatic group.
This finding in the present study provides a key consideration and have significant implication for the COVID-19 treatment and control. However, further study is required to address the therapeutic aspect of the microbiome based on the interventions.
Significant difference between recovered cases and the disease cases. So, are you going to have any further studies to have get the concluding results on this?
Right, ma'am. Right now we are also recruiting more patients if we are getting. It is possible, but we found only the richness differences in between the recovered as well as the demised patients in terms of alpha diversity.
Just a small suggestion, if you can get some of the breakthrough and reinfection cases and look at how they are behaving different I know pharmacological intervention is the most important, but why some people are having higher tendency to get infected?
Initial days when we had nothing, no vaccine, no drug for this, everything was being tried. So people tried to boost immunity. They say, let us explore immunity. So there was data showing that low levels of micronutrients were associated with adverse clinical outcomes during viral infections. And many organizations like European Society of Clinical Nutrition and other organizations came with some set of recommendations about macronutrients as well as micronutrients.
Since the beginning of the pandemic, when everybody was apprehensive about dealing with the disease, our department voluntarily took up the challenge of dealing with COVID, and ours was a completely designated COVID hospital right from the outset of the pandemic. We tried to adapt to the challenge which was with us. We increased the manpower, the labs inside the hospitals were upgraded, and ICU with full ventilatory capacity was made functional.
The first thing that I want to talk about is something called incisive model. It's a model that we developed, and its applications to the first wave of COVID-19 in India. So here is a reference to this piece of paper. This paper should appear soon. The idea here is to look at COVID-19, look at the progression of the disease COVID-19 across different categories of patients or people infected. Most people with COVID-19 will be asymptomatic for the disease. From the point of infection, they will be exposed to the disease, then they will enter asymptomatically infected, in which they can infect other people but show no symptoms themselves, and then they move to a recovered compartment. If you're mildly infected, you will go from being exposed to being pre-symptomatic, and then you will enter a symptomatic. So at this point, you have show symptoms, and then you will recover.
It's better we build our own capabilities, we build our own technology, and we nurture our own innovation ecosystem, so that COVID-like situation, if it hits us again, we may have better solutions for the future. If you want to face COVID-like crisis or climate change-like crisis, looking for breakthrough and big technology is not always a right option. You can begin with humble technology, you can begin with small technology, and these small technologies can lead to big breakthroughs.
We are trying to amplify the S1 region, that is the most hypervariable region of infectious bronchitis virus, and it is the most immunogenic component of this virus. So we are trying to amplify the S1 gene, and we are trying to sequence them and covering all the hypervariable regions and do the downstream phylogenetic analysis so that we can get a clear idea about what kind of strains are circulating in the northeastern region.
First, we clone whole genome inside a one vector, PUC19 modified vector, and it has the all promoter and transcription, termination, all these things. After the cloning whole genome inside a one plasmid, we transfect and we recovered the virus. We amplified the virus, embryonic chicken eggs, and we confirmed the virus by the HA, RT-PCR, and Western blot.
Thank you so much. It was a very interesting session, and thanks for the interaction. Unfortunately, it was not that much. Thank you so much.
These technical sessions will be assessed for your performance. So we are evaluating the performance on the basis of your presentation, your content, your knowledge, presentation skills, styles, and what was the response for the audience question.
The challenge was to study against the variant of concern, and so we continue our genomic surveillance from the beginning. In the beginning from January to August, we did a countrywide survey and we demonstrated that which variant in our country. But as soon as the variant of concern started coming, we did use two laboratory and airport of Mumbai and Delhi. We got different samples of COVID continuously and we did virus isolation.
Since morning, this is the second presentation of the infectious bronchitis. So this disease is mainly of the chicken, you can say the avian disease. And it affects mostly the respiratory system, urogenital system, and the kidney. So these three systems are mainly affected, and this disease is having economical impact on the poultry industry worldwide. As you know that this is also caused by the coronaviruses. Coronaviruses belong to the Coronavidae family, but the genus is the family subfamily is gamma coronaviruses, and it is a single-stranded positive-sense RNA viruses.
It is this interaction between the receptor binding domain and human ACE2 that initiates the viral entry. In case of human ACE2, which is a receptor that is expressed on many pulmonary as well as extrapulmonary cells, and it is an important player here. There are certain residues within the ACE2 which interact with the receptor binding domain, and there are certain regions which do not show any interaction. So we chose the interacting region as a binding and the non-interacting region as a non-binding. So these act as a positive and a negative control for our experiment, because this particular region is going to show a positive interaction, positive protein-protein interaction, and this will be showing a negative protein-protein interaction.
What was the basis to use this bacterial to hybrid system?
Basically, for protein-protein interactions, it is always better to use bacterial to hybrid rather than yeast to hybrid system, because yeast has homologous genes that are homologous to our system.
But don't you think so that post-translational modifications will contribute?
Yes, exactly. But we did not choose the whole protein here. We only chose like domain regions. So post-translation modifications happen after like complete translation of the protein. We only use the residues for studying the interaction, not the complete proteins.
About COVID-19 is due to affordability and better computational algorithms to process genome-wide data, there has been a significant growth in genome-wide screens conducted for COVID-19 like protein interactions, RNA, CRISPR screens, transcriptomics and proteomics sought to take advantage of this, and this is how our workflow goes. We accumulated transcriptomics and proteomics data from published papers, pre-processed them, shortlisted them using an overlap analysis and cumulative score selection, and went forth with experimental validation to obtain prognostic markers and therapeutic targets.
Ahead, and one of my colleague, Dr. Ghulam Hussain, who isolated a local isolate from Odisha from a COVID positive patient. So he went ahead, he characterized it thoroughly through whole genome sequencing, and using that isolate, my group established this hamster SARS-CoV-2 challenge model at ILS, and it recapitulated almost all the phenotypes that people have already reported, and we have went ahead and done some proteomic study on this.
Introduce you all to the model, the Syrian golden hamster, as we have talked enough about this model, but I would just like to mention that why this has been chosen as a model for SARS-CoV-2. The infection and pathology in hamster is similar to that of humans. It recapitulates the human pathology. Moreover, the hamster AC2 binds tightly to the SARS-CoV-2 S protein, and the hamster AC2 protein is more homologous to the human AC2.
We concluded that the wastewater samples that had the virus, and the virus was shed by the infected people, we sequenced wastewater using the SWIFT SARS-CoV-2 SNAP protocol. Samples were collected in March 2021 to June, and it was seen as a rise of the alpha variant, and we also saw the signatures of the variant present in the wastewater, demanding, thus we could demonstrate the ability to track the variants in the wastewater samples.
I thank all the speakers for delivering wonderful talks and sharing their highlights of the research activities. Thank you very much.
I request Dr. Pragya Yadav to felicitate Dr. Varsha Poddar as invited speaker of technical session 1. I request Dr. Sabya to please felicitate Dr. Arun Patel as co-chairperson of this technical session 2. I again request Dr. Shehnaz to please felicitate Dr. Pragya Yadav as invited speaker of technical session 2.
What enabled the SARS-CoV-2 vaccines to be developed so quickly was this sort of state-of-the-art knowledge of other coronavirus vaccines. Also, the ability of multiple platforms to be able to be rapidly leveraged in order to support vaccine development. So there are various platforms that have been used to present COVID antigens, SARS-CoV-2 antigens. I think we were very lucky to have a very clear and identifiable target in spike, and that the urgent need was obviously met with urgent provision. So there are very quickly a large number of vaccines available need to sort of provide this vaccine coverage at this level, at a global level, if we really want to control COVID.
During the entire pandemic management, if you look at it, we ignored one part, which was, how it could go from human to other animals,
how it could mutate and again come back to us and we would never know. Now everybody has accepted that COVID is, affecting felines. And that is why there are currently, clinical trials ongoing for inactivated SARS-CoV-2 vaccines specifically for felines, that is lions and, other zoo large felids, tigers and all.
I have working on 2 projects on the animal viruses under which I took this coronavirus from the animal origin, and these viruses, not much work has been done, especially on canine viruses, canine coronaviruses. Only few reports are there in India. Though abroad many reports are there, but in India very less work has been carried out.
Any artificial intelligence-based solutions need data. And we know that there are, at least for the pandemic response, these 3 key elements that you can look at. There's a data gap, which means that the data platforms exchange, and it's a time-consuming process. There's also the knowledge gap. Once you have the data, what do you do with the data? We may have computational biology, but we have very few data scientists who actually can bridge biological, clinical, and public health understanding. Then there's a need for converting this knowledge into policy actions. And that means that learning decision models that can help take decisions at the policy level.
The study was planned with 2 objectives initially. The first, that is study what is the prevalence or status of COVID-19 in non-human host. Second, that is molecular characterization of SARS-CoV-2 of non-human host. And we had additionally 2 more objectives covered during this study. That is seroprevalence of this SARS-CoV-2 in non-human host, as well as we had tried to study the co-infection of various viruses of animal origin.
After investigation, once you studied your animals, what was their peak viral load? And with peak viral load, had they any symptoms? And if symptoms, I would like to know, is there a study, what was their immune response, their cytokine response once they had RT-PCR positive and viral load high?
So whatever sample we had collected, that is a single time sampling, and we had seen that CT values are very high, and we had observed, we had correlated, those samples were found, we had tried to contact them. None of the owner or none of the animals showed the unusual symptoms or any mortality in that particular area. And the similar that report we had also submitted to OIE. They had also asked for such clarification. So there is no unusual mortality in any species. Even the in contact person, they are also healthy. So I can say that there is no question of zoonosis at this point of time.
One Health is a collaborative, multi-sectoral and transdisciplinary approach, working at the local, regional, national and global levels, with the goal of achieving optimal health outcomes, recognizing the interconnection between people, animals, plant and the environment. The recent example of COVID-19 pandemic, which is a human health crisis caused by a virus passed from animal, that is pangolins. This highlights the need of coordinated action across the sectors.
At the time of first, second, third, fourth passage, it behaved as at par with the oseltamivir. But at the time of 10th passage, so it behaved like oseltamivir was not at par. So what would be the reason for that?
Because viruses accumulate the certain mutations. As we have seen in the oseltamivir, there are 2 major mutations virus hemagglutinin acquires for this oseltamivir. So that is the main reason for the resistance of the virus. It does not respond to the oseltamivir anymore after the 10th passage.
My concern would be, first point you just mentioned that it worked even after the receptor level. That is sure, because DPUDs are anti-tumor action and they are really cytotoxic as we are dealing with humans. So I would like your comment on the cytotoxicity and cellular safety level of this drug. Once we are comparing drug to drug, you have to be sure, are they safe to be used on cells because they have high cellular toxicity.
Thank you for your question. But we have tested the CC50 using in the cell lines, and we found that it was very good, I would say, as compared to other drugs which are available. And also we tested this in mice model, and mice were fine even after the 21 days of administration with the continuous treatment. So I don't think so the cytotoxicity is a major concern for this.
We are very fortunate to have her with us, and over to you, Dr. Gagandeep.
Now, the interesting thing is that for most of the variants that we had previously, they use both the ACE2 receptor as well as TMPRSS2. So, if you want to block viral entry, you need to block all mechanisms of entry, both ACE2 binding and TMPRSS2 binding. Requirement to develop new vaccines and develop them quickly has resulted in a situation where our world in data shows that on Monday, 65.5% of the world's population had gotten at least one dose of vaccine, that 11.7 billion doses of vaccine had been given globally, and nearly 2 billion of those are in India alone.
We really need that interferon systems in humans as well as porcine are the real culprits or helpers. They are knocking humans down, but are similarly protecting animals here. Right. And do you agree that further studies is needed, or you know of any study which interferon systems in animals will be beneficial and will we get a lead from them? Anything you want to tell us?
Yes. See, we are planning a future study in order to understand what is the response to these viruses as far as the pig model is concerned. As you pointed out, and it is well known, like the cytokine storms is the one which causes a lot of damage rather than protection, especially for these kind of acute infections. And non-human species, the kind of immune response which is observed, the inflammatory response which is observed is mild or low. And what is the reason for it, and how these kind of host microbe interactions are happening, that need to be explored and looked at. Probably that kind of understanding will definitely help to, redesign our treatment as far as human models are concerned.
In wastewater epidemiology or wastewater surveillance, sample is collected from sewage treatment plant or wastewater. So this wastewater or this STP has contribution from multiple individuals who are residing in the community, and only one sample is collected from STP. Based on the result, one can actually estimate how many people are infected in that particular community. And if we are able to sequence them, like I said before, we can actually see what all variants are present in the community. A sample from STP can give information about early warning of emerging waves, and one can actually estimate the number of people infected in that community if one has a sample from STP.
I would like to ask, which was the sampling technique you used? How can you extrapolate the findings?
Yeah, so what we have done is, though I have not shown the data here, we have tried both grab sampling as well as composite sampling. So composite sampling, one collects samples at different time points and then analyzes them. So we have done this comparative analysis of both, and we have identified a time point at which it reflects. So it's in the early morning hours.
Start the felicitation of our chairperson, co-chairperson and rapporteur of the session.
Throughout the pandemic, we've been so much focused on vaccines and just observing how quickly the virus is trying to evade the vaccines. And all of that pertains to evading the antibody response, which is the adaptive immunity, which comes in later actually. The first hurdle virus has to face is what is called intrinsic cellular immunity. And that immunity is inbuilt into every cell of our body. And pretty much entire setup is available for every cell to counteract against incoming virus.
In immune system medicine, we see that there are certain immunomodulator drugs like with somnifera and Tinospora cardifolia. They reduce the oxidative stress. Do you have any experimentary evidence that really they do oxidative stress activity or immunomodulator?
I think for
immunomodulation rather.
No, so immunomodulatory activity of Withania extracts are very well established beyond COVID-19. I mean, people know that it works, not just for this infection, but variety of respiratory infections. So I think that's already proven.
So you do support that they have activities on molecular or immunological level, you know?
Yeah, they should have, but they cannot be relied on solely for treating COVID-19. And maybe not a good idea to give when person is in a severe disease, when he needs a stronger immune response instead of, immunomodulatory, which can be immunosuppressive.
We have supported more than 200 startups, which are founded by around 600 entrepreneurs. So nearly 600 entrepreneurs, similar number of innovators we have supported across our various programs. Yeah. Just to give you a sense about the performance of the startups, this is across domain. I'm not talking about just COVID specific or any particular domain. Yeah. Just to give you a sense about the performance of the startup, collectively the startups have generated employment of more than 5,000. They have generated 200 plus IPs. They have raised funds to the extent of 4,500 crore.
We are presently incubating around 20 ideas, and we have launched some companies also. So we will be very much pleased if we could have in collaboration with your organization regarding the startups.
We will be happy to work with you on one is that policy side, because when an organization or academic institution starts commercialization or startup program, lots of policy things need to be put in place.
What is the percentage of the neonatal death in pregnant women? Number 2, what is the range of neonatal death in infected mother?
From the early phase of pandemic data, there were not many neonatal deaths. So neonatal deaths during the second wave are higher than the first wave. So this paper is under revision in the International Journal of Pediatrics now. And when we look at the other neonatal complications like congenital anomalies and all, so we didn't find any major complications.
I would like you to comment on neural tube defects in pregnancy and in neonatal complications vis-a-vis COVID-19.
As I said, we are analyzing the detailed data on the pregnancy the congenital anomalies especially. There was not much change in the neural tube defects from the pre-pandemic data when we looked at the pandemic data. So we don't feel that, although it will be premature to comment at this moment, but unless we analyze the complete data.
Post-COVID, due to exposure to drugs, due to hypothermia and long COVID, we have seen slight increased incidence of neural tube defects in pregnant females. Please don't lose sight of that, and let's have it from you. What is the incidence? And
Sure. So we'll look at the complete data from the 19 study sites. Probably we may come out with some important observation apart from the neural tube defects. Probably
it's also important for us to look at ecologically sustainable development patterns which do not permit zoonotic transmission from forest-dwelling animals to veterinary populations and human habitat in the first place. Therefore, coupled with the best of science, we must also look for ecologically sensible solutions in order to prevent coronaviruses from becoming major public health threats.
Before going for startup sessions, we would like invited lecturers to be felicitated.
So actually Minvax is a startup co-founded by Professor Agwan Vardarajan and Dr. Gautam Nadik in the year 2017, and it mostly works on subunit vaccine development for influenza viruses as well as for SARS-CoV-2. So for the moment, it will be mostly focused on the design of an immunogenic and highly tolerant COVID-19 vaccine.
You must have studied how much input is required to produce, let us say, some 10 ml of the vaccine.
Yeah, so actually the immunizations that have been done in the mice model at very low concentrations of 20 microgram, and these proteins actually, even for Pichia, are giving a yield of at least 80 mg per liter or so. And even for the mammalian system, we are getting yields as high as 2000 mg per liter. So it's quite high.
You have shown that this is a good neutralization efficiency against all the variants of concern, including the Omicron variant. Suppose tomorrow summer variant flares up, an escape mutant. What will be the turnaround for you people?
This is a really good question. So what people do and what we have tried, and as soon as we get a beta variant, so what we did is, if you take a beta mutations which are there in receptor binding domain and you purify it, it is not stable. You store the protein and after that you run it on a gel, it's degraded. But we incorporate these mutations, it is stable. So what we have done is we have made a cocktail where we have the stabilized mutation RBD along with the mutant which was there with those beta mutation.
So Austic Pharma has been working in healthcare sector. Major concern was during pandemic COVID-19 diagnostics. We have targeted two different types of the products. First one is rapid COVID-19 antigen test, which is known as RAT, RAT, for early diagnosis, which is essential or required for the mass screening of the population where PCR test cannot be conducted. Second test is the rapid antibody test, COVID-19 antibody test. This is a combination of IgM and IgG test for the surveillance purpose. So this test can also be used for the surveillance in the mass population.
So during COVID, as it is an enveloped viruses, we tried to make the existing nanoparticles which were activated towards the coronaviruses, we tried to trap in the film and we tried to make it activated towards our film. So what we have been doing is creating a nano layer on the films, on the surfaces like wood, clothes, glasses, handles, and different kinds of surfaces. We have customized our solution, which makes it water and stain repellent, as well as it is also making it antibacterial and antiviral. Also, it is controlling the bacteriostatic, that is the growth of the microorganisms.
And I'm pleased to tell you all about the funding opportunities that we have at India Alliance for researchers working in biomedical research. So India Alliance is a public charity that funds research in health and biomedical sciences in India. We are funded by the Department of Biotechnology, Government of India and the Wellcome Trust UK. And our mandate is to invest in transformative research. Now the objectives of the India Alliance Fellowship Program have been to implement a globally recognized grants funding model, to assist in the development of mechanisms that can nurture outstanding biomedical scientists in India, and finally to devise new mechanisms to promote clinical and public health research in the country.
If the initial response is delayed, COVID-19 pandemic can spread explosively in local communities, making it difficult to control using subsequent social distancing strategies. The lessons learned from this fight are essential to prevent any further wave from entering our region.
In first wave, less doctors got infected. In second, some got infected. And in third wave, most of the healthcare workers were suffering. So it was a real, cumbersome job for us, how to manage patients. Infectivity rate was high, positivity rate was high, but luckily mortality was very low.
We would now like to felicitate our worthy guests. I would request Professor Nazir Ahmed Ganai, Honorable Vice Chancellor SCOST K, to present a bouquet, shawl and memento to our esteemed Chief Guest, Shri Rohit Kansalji, Principal Secretary, Higher Education Department.
I can already see the establishment of networks and talks on collaborations, which has been the greatest weapon for the fight against COVID-19. This conference was a baby step to achieve the goal of global network formation. We had participants not just physically, but we also connected through virtual mode, shattering the limitations of the physical world. Virtual collaborations are beautiful adaptations that this pandemic has taught us. I can see the motto of the conference, which was focused on cross-fertilization of ideas being achieved. The discussions so far with our keynote speakers, invited and expert speakers, along with our startup pitch, have assured us with the hope of better prepared for tomorrow and have equipped us with knowledge to tackle with the pandemics at regional as well as global levels. Thank you.
Information is currency of development. We live in the age of information. It was the information that played a key role, important, especially in the fighting against coronavirus. pandemics, and we all are witness to the daily updates, advisories, and our information department was able to provide during the difficult times of pandemics.
We would like to have feedback from some participants of the conference.
So I would like to thank the university organizers and especially Vice Chancellor and all the rest of the academicians who have made it possible. And apart from this, the students who have actually made it possible. People see that it's not just research is restricted to the academic perspective. We can have a private firm, collaborative efforts with academia, but at this stage of time when you are studying as a master's, maybe a graduate or a PhD student, this conference paves a new way to see a new perspective. So this is something unique, and I'm really grateful to Dr. Nadeem that he has come up with this kind of idea.
I think the conference was held on a very beautiful place, and it's a beautiful university I have explored. Of course, has been a great host for us, and thank you so much, sir. We're going to come again and again, and we are looking for collaborations all together, and all the scientists, all the founders who have done recommendable work in coronavirus, and we are all here to save the world and to make it a better place.
Now I would request our head of the family, our visionary and dynamic leader, our inspiration and constant motivator, Professor Nazir Ahmed Ganai, sir, Honorable Vice Chancellor SCOST K, to address this August gathering.
The intellectual wealth we have in this country, the kind of the resilience is there in this country, and the kind of the technological backup which we have developed over the last 75 years in this country has helped us to come up fight against the COVID. We came up with the vaccine, our own indigenous vaccine. We appreciate, we acknowledge the contributions of the people, the scientists, the doctors, all of those guys who have helped the society to fight against this disease. Of course, the agriculturists who have given us the resilience during those very tough times. We want to just ensure that, work on that One Health program. We have to just cross the boundaries and join together. Together we should join hands and see that how together we can work to make this place a better place, a safer place. And we should also remember that this virus has not gone out of the environment. It still exists there, and who knows, maybe tomorrow some new kind of a challenge comes to us. So it has given us the understanding that how important is the biosafety and the biosecurity. It has to be a routine program or routine course, and we must continue to build the skills of our students. Thank you very much.
I think when it comes to education, we are at an extremely important cusp because we are implementing the National Education Policy. And the National Education Policy represents a paradigm shift. As I said, it represents a shift away from our traditional modes of thinking towards a mode of imparting education which is not just flexible, which is not just multidisciplinary in nature, which is not just about breaking down silos, but which is also about giving a new meaning of education, making it more skill-oriented, making it more employable, making it more meaningful. I thank you for inviting me, and I do hope that the university goes from strength to strength. Thank you very much.
At the end of the day, it is my privilege and honor to propose vote of thanks on the validative function of the International Conference on Coronavirus, past and present and future, held from 10 to 11th May 2022, which was organized by the Division of Animal Biotechnology, sponsored by UK-ICN. The conference was indeed a memorable event for Sher-e-Kashmir.
Now we'll proceed to the award distribution ceremony.